Oh, hi, everyone. Thanks for joining us today. Happy Monday. I'm Robin Haynes.
And I'm Audrey Hassan. As the calendar keeps drawing us closer to winter, we're helping you get prepared for your good health.
And no better way to do that than with our good friends at Licking Memorial Health Systems, which includes, of course, President and CEO Rob Montagnes.
Well, you know, with many things, we like to be proactive. We're going to talk today about how we lead the charge for our entire community.
A big first step in that process is immunizations. So we look at what vaccines should top your list and who needs them. We're also talking about the winter slips and falls, how to treat them, or better still, how to avoid them. Then we turn a light on seasonal depression. What is it, what causes it, and a simple way to help treat it. And don't miss the 5 facts about Licking Memorial Health Systems. It's all right here on Daytime.
Well, of all the threats we face during the winter months, it's the ones we don't see coming that can cause the most harm.
You know, last year, Robin, the flu season lasted 21 weeks, which was more than the typical 16 weeks. 41 million people were affected, and it can cause many deaths each year, too. So the flu season is very important to pay attention to.
Yeah, and it's why there is such a consensus in the medical community about the importance of immunization. So joining us now, we have Dr. Rachel Demita from Licking Memorial's Infectious Disease Department. It is so good to have you here today.
Thank you for having me.
All right, so if we talk about the major winter season illnesses, obviously we think of the flu. Anything else kind of included in that?
Well, flu first and foremost, that gets the most attention. Other viruses that tend to circulate around this time of year include parainfluenza virus, RSV, croup. Those 2 viruses tend to be more problematic in the pediatric population. Norovirus is also tends to predominate in the winter months, and then also both viral and bacterial pneumonias.
Okay, yeah, I've heard that for sure, being a mom, all of those.
Mm-hmm.
We talk about the flu vaccine and the effectiveness. You know, how effective is it? How worthwhile is it to get the vaccine, and maybe how it changes from year to year?
Now, you know, when talking about vaccinations, no vaccine is 100% effective. But when it comes to vaccines that are given typically during childhood for such as like measles, mumps, rubella, diphtheria, things like that, those are anywhere between 90 to 99% effective. And when it comes to influenza, in general, flu vaccine tends to decrease flu complications and flu illness by anywhere between 40 and 60%. So pretty significant.
Yeah, that is. It's worthwhile, definitely, when we talk about this. And so let's talk about who should be vaccinated. Is there anyone not on the list?
Well, no, everybody should be vaccinated. There are certain populations of people who can't be vaccinated, whether it's because of their age or underlying comorbidities, things of that nature. So that's why it's very, very important for people who are able to get vaccinated to kind of preserve that herd immunity in the community. And the way that works is, you know, when a large subset of people is vaccinated, it kind of indirectly protects those patients or those people who can't be.
All right.
Yeah, very good point. So we talk about vaccines. What are other things we can do so we don't spread germs and spread illness throughout the winter months?
Well, hand hygiene,
yes.
Super important, whether that be just with alcohol-based hand sanitizer or soap and water. Cough etiquette, such as covering your cough, you know, specifically trying to cough into the crook of your arm as opposed to coughing on your hands. And also just, you know, being aware of who around you is sick and staying away from them if you can.
All right, doctor, you are an infectious disease physician, I mentioned, at Licking Memorial Hospital. When you talk about that role, when you talk about kind of what your job is in keeping the community safe, you know, share with us a little bit more about what you do and you know, to the community.
Oh, well, infectious diseases in general kind of encompasses a lot. But, you know, my role primarily is within the hospital. I see patients who are admitted with infections, but of all different types of infections, but also try to educate and, you know, talk about vaccines and other sort of preventative health to keep patients out of the hospital, keep them healthy.
Okay, one of the big things is antibiotic stewardship. She's extremely helpful So folks want antibiotics, but oftentimes they're not necessary or required,
Right.
and we want to minimize that usage. So she does a tremendous job in helping us with our stewardship.
I'm
Yeah.
very passionate about that.
And to that end, I know a lot of people probably come in and push for, I need something to make me feel better. And I'm sure you have said many times, right? If it's a virus, it's got to run its course,
Exactly.
right?
Exactly right.
Any advice for people out there as we head into winter then, doctor, as they get ready to kind of fight these? Because I've kind of had this lingering cough, you know, things like that, that you should just let it run its course?
You know, it's very, very difficult to kind of sometimes undo that expectation of getting an antibiotic when you come into the hospital. But, you know, strength in numbers is important. And the more we can get, you know, physicians and other healthcare providers kind of delivering the same message, saying, you know, this just has to run its course, I think people and patients in general tend to be a little bit more understanding.
Absolutely. All right, doctor, of course, you could reach out if you have any concerns and issues to the team at Licking Memorial. It's lmhealth.org. So thank you for being with us.
Thank you.
Later in the show, Rob will share some details on a free children's flu vaccination event. But first, we're going to tackle another common ailment for winter injuries from a fall.
Up next, we're going to talk about short and long-term results of falling, how you can possibly avoid getting hurt in the first place.
If there's one thing an ER nurse or doctor can safely predict, it's that when the snow starts falling, they'll soon be treating patients for injuries from a fall.
And those injuries can be everything from aches and sprains to more serious breaks and even head trauma. Happy to be joined by Dr. Robert Moeller, board certified orthopedic surgeon, and he's going to share some facts about how to stay safe during the winter months and not have to see an orthopedic surgeon.
Sure. Doctor, thank you for joining us. What are some of the most common types of injuries when people fall on ice or snow?
Well, it's my pleasure for being here. The common things that we see, of course, wrist fractures, ankle fractures, hip fractures. It doesn't always have to be something broken. You know, it can be a sprain of some sort. Ankle sprain's very common. Foot fractures, you name it. You know, if it can be broken, we'll end up seeing it, right?
Sure. And I know a lot of times it's busy around the holidays and things like that. How should people respond for treatment? Do they contact their primary care physician right away, or is it best to immediately go to an urgent care or the ER?
I think that's a great question. I think everyone has to sort of evaluate that for themselves, see how bad they really feel. If it's really swollen, if it's really feeling badly, then they should get evaluated. In many instances, it's not that big a deal, but for a lot of folks, it ends up being something important. And so generally, we don't recommend waiting. I think, you know, waiting a week or two is not a good idea a lot of times. We certainly see things late that can become a real problem for people. We'd much prefer to see it earlier rather than late.
Sure.
So maybe talk about some of the treatments without getting into too many specifics. Sprains versus breaks, physical therapy needed, not needed. How do you treat those?
Right. You know, the first thing that you do over the telephone is rise, right? Rest, ice, compression and elevation, the things that people can do at home that can make it feel better. Mm-hmm. And of course, if they can tolerate it, an anti-inflammatory medicine can be helpful many times as well. Beyond that, you know, our treatments really are based on what the problem is. Sometimes it's something simple as a support, an ACE wrap, a cast, crutches. You know, it really does vary from person to person and injury to injury.
It's also common for people to hit their head during a fall. Now, is it that common, though, to hit their head or head trauma that you've seen, Doctor?
You know, I'd hate to give you numbers on that, but absolutely. It's one of the things that happens every day, and it doesn't have to be slippery and wet outside for that to occur. That can be many times a product of just a bad situation, and so the consequences can be devastating, obviously.
Well, I'm sure you like to be busy, but at the same time, we want to keep people safe, and we hope they don't have to see you. So what are some recommendations you might give them so they don't slip, they don't fall, they don't get injured during the winter time?
Right. You know, I'm always trying to put myself out of business, right?
That's right.
So, you know, what are the things they can do? All sorts of things. You know, one of the things primarily is just to make sure that and I think we're talking a little bit about the slipping on the ice kind of thing. So, you know, you want to take a look at where it is that you're walking. The classic complaint is the black ice problem, right? They don't look before they walk. Not paying attention to where you are, planning ahead, walking in designated walkways, that sort of thing. Wear footwear that has traction. It's nice if you can do it. Trying to keep your arms empty so that you can move comfortably if you need to. Keeping a low center of gravity, bending your knees a little bit, making sure that you're careful with your steps.
And again, if we go back to some of those, you said there are a lot of head injuries with that. What are some of those consequences that you said could be so devastating?
Well, obviously there's one really bad one, right? You can die. But beyond that, other things before you get there, subdural hematomas, bleeding into the brain, that is probably one of the most sensational or worse consequences. But it can be something simple like a head laceration where you still need to get the thing sewn up so that you can, because they bleed a lot, frankly, so that you can get the bleeding under control. A lot of folks are on blood thinners, and that can really be a problem for them. As the older folks tend to fall more, the consequences tend to be a little bit more severe for them than they are for the young people. It's just a super common problem that they see in the emergency room.
Sure.
Absolutely.
And again, Licking Memorial Health Systems, you're ready to help treat you and your family. In fact, coming up later, we'll talk about some of the urgent care locations that they have available when illness or injuries do strike. Thank you so much for joining us, Dr. Mueller.
Thank you. It's my pleasure.
Well, as we continue today, we'll look at a more subtle way the winter months can impact on our health, specifically our mental health.
Yes, up next, we're going to talk about seasonal depression, the best way to bring a little light to the dark and gray months of our winter.
If you are finding yourself maybe a little moodier as we change seasons, you don't just have to deal with it. It's why Rob Montagnes and I are now joined by psychiatrist Dr. Elizabeth Yoder here at Licking Memorial Health Systems. And we really want to talk about this, Elizabeth, because this is the time that everybody is starting to see these symptoms, right?
Absolutely. Yep.
What is SAD?
So SAD stands for seasonal affective disorder, and it's a variant of depression. So when we think about that, it's the symptoms of depression that are beginning typically in the fall and that continue until the springtime.
Okay.
Well, you mentioned symptoms. What are some of the symptoms, maybe as a loved one, that you would look for or try and recognize in either yourself or someone in your family?
So it's very important that this type of depression actually coincides with the regular symptoms of depression. So we think about low daily mood, lack of interest, feelings of hopelessness or guilt. Sometimes there can be changes in energy where they just feel like they don't have the motivation or the drive to get up and to do things anymore. Interestingly enough, with seasonal affective disorder, we tend to see sleeping more than usual, and we see increased appetite, especially when it comes to craving carbohydrates. So I think sometimes along, especially with the winter months, it's almost like hibernating like a bear.
Okay.
With the more severe variants, you can absolutely have suicidal thoughts, and so it's a very significant condition and is one that I'm frequently educating my patients at the end of summer, right into fall. Hey, these are the things we need to be worrying about and being on the lookout for.
Sure.
And what are the causes of this? I think we all feel like we hear winter blues as a term commonly used, but what are the causes of this and being more, I guess, serious of an issue than you would typically think?
Yeah, it's definitely a clinical concern. So we don't know the exact cause, but what we do tend to think is that there's an association with decreased levels of light. So in particular, as the fall and the winter come, there's lower daylight levels. So there's a thought that there's maybe a change in our circadian rhythms and that's something that can increase the depressive symptoms. And there's also another theory that looks at the increased sensitivity of the retina in the winter months, and for people who have seasonal symptoms, maybe their retinas are not as sensitive as others.
That's so interesting.
Yeah, so we can't change the weather, obviously. So what are some
Absolutely.
of the ways you can deal with this or treat this?
So I'm talking to my patients a lot about how now is the time to be pulling out the sun lamps. So bright light therapy, especially if it's more of a mild variant, is a first line treatment. And that consists of buying a sun lamp that you're going to use for indirect exposure, so not directly on, but to the side, anywhere between 16 and 30 inches. And we definitely want to recommend first thing in the morning, you wake up, you turn on the light, and maybe while you're watching watching the news or you're reading the paper and having coffee, you want to have that exposure. It's very important to have consistency in that. For the more severe cases, we're going to combine bright light therapy with medications, and those are traditional antidepressants, so things along the lines of Prozac or Zoloft, and also Wellbutrin is a great medication, especially if you're trying to also kick a smoking habit. That's a medicine that can be used for both.
Great.
We also have adjunctive treatments or things we can add to, so exercise is extremely important. We want to get out there, get morning walks in, sleep hygiene, so making sure you're going to bed at the same time, getting up at the same time, and practicing good sleep hygiene is very important as well.
I know it's tough in the winter to exercise, but it seems to help almost all conditions.
Universally. So and that's something we're really trying to emphasize, that getting out there, even if it's just starting 5 minutes and building up, but that's something that, especially if they're not open to or not wanting to take medications, it's a great way to be able to combat those symptoms. And you combine that with psychotherapy and you've got a very balanced approach.
Great.
Absolutely. And I was just going to add that, you know, at least recognizing that it is a clinical issue, that you don't have to sit at home and just deal with this is probably one of the most important messages to get out there.
Well, and I think prevention is huge. So if you're recognizing that, man, in the past couple years, maybe the holidays are harder or the winter months are harder, knowing in advance, then getting the bright lights out, planning for it can make it a lot easier to jump ahead of it and get on top of the treatment early.
Absolutely. Dr. Yoder, thank you so much for educating us on this today and knowing that people out there have somewhere to go to get the help they need.
Absolutely. Yep. Thanks.
Well, Robin, hopefully we've taught you a few things about recognizing some of the threats to your health during the winter months. And up next, we're going to tell you where maybe you can get some treatment for those items.
Yeah, and we've got your 5 important facts from Licking Memorial Health System, so stick around for that coming up after the break. All right, we are now in the point in the show where Rob gets to share with us 5 facts about the Licking Memorial Health Systems.
Every day, Licking Memorial Health Systems is actively working to promote good health in their community, which is, of course, the mission of a community hospital.
Yeah, we kicked off today's show, Rob. We talked about the importance of immunizations. You have a yearly kids flu vaccination event, which I think is highly important for any community. Tell us how you guys handle this.
Yes, we have an event called Be Wise, Immunize, and we have it in 2 locations, Pataskala and Newark. We've already had it. Well over 400 children were immunized. But certainly if you miss that event, you can still go to your pediatrician, to your family doctor, and become immunized. It's very important.
Yeah, absolutely.
And Rob, your staff leads by example when it comes to flu vaccinations. Talk to us a little bit about your percentage rates.
One of the best ways we can help protect patients is by making sure our own staff is immunized. And we are well over 95%, which is extremely high in the industry. 95% of our employees receive the flu vaccine, which ultimately helps us protect our patients.
And that is it. We've talked off camera just kind of about how it's our job to protect those who can't protect themselves. So all of this highly important when you're working in the medical community.
No question. We are there to help people get better. We don't want them to become compromised because of us.
Right, exactly, to be that cause. All right, even though it's getting cold outside, we may not like to go for a run.
I know, we were talking about that.
Yeah, but it is still a really great time to have your events. You have these Walk with the Docs, and this is access that people don't get all the time.
Correct, absolutely free. And Dr. Muller talked about maybe not knowing when there's black ice or it's dangerous. These events are inside. They keep you active during the winter. We have them at the YMCA in Newark, in Pataskala. We work with Denison and have events there. So our next Walk with the Doc, I believe, is focusing on women's health, but they're very informative. It's a good way to get some exercise, and they're very safe.
Yeah, to
There you
get
go. I like
indoors
that, yeah.
and exercise and stay out of the cold sounds like a great idea. But urgent care has become a lifeline for so many busy families. You have 3 Licking County locations for non-emergency winter illnesses and injuries.
Absolutely. 3 locations throughout the entire county. So on the west, we have one in Pataskala, sort of central on the Granville-Newark border, and then further east in Newark. All 3 locations are readily available for minor injuries, cold, flu type symptoms that need treated. Certainly if there's any concern, you can always come to our emergency department, but the urgent cares are a great opportunity for folks and much shorter waits typically.
I was going to say, and that is the thing, and we think about urgent care a lot of times when they are those kind of off-kilter times when we can't make it to our family physician, something's wrong, you're a little bit nervous. It's a great resource to have, and now close to anybody that's in the Licking County area.
Absolutely, throughout the entire community.
All right, Rob, this is the other thing. An important link you have to Good Health is your outpatient psychiatric services. 3 physicians, a licensed clinical counselor on staff. Is that something people should take advantage of?
No question. We talked about seasonal depression, but there could be other issues. Obviously, physical health is important, but mental health is extremely important as well. And so we have folks have concerns or issues and they need some mental health services. We have a number of providers available for them, and certainly they can call and make an appointment.
Rob, as we get ready to hit winter, to hit these colder months when a lot of people are worried about illnesses, worried about falls and things like that, now is probably a good time to kind of have all these resources on hand and ready if something were to happen, right?
Yeah, no question. That's why we thought this would be a great topic. We are coming off some 60 or 70 degree days, and so we may not be thinking about ice and snow and shoveling and all those kinds of things, but they will be here very, very soon. And so hopefully take some of the precautions now and get yourself prepared for the winter.
All right, and of course you gave us so much to think about, as you always do. We want to stay healthy, but we want to stay safe as well. So both of these going hand in hand as we get ready for the season.
Yes.
Exactly.
All right, well, it just makes good sense as well to be proactive every single day when it comes to your health. Licking Memorial Health Systems wants to be that resource for you and your family, so we hope you gave you a lot to think about today.
Exactly. Stay healthy, stay warm this winter.
All right, it's been a pleasure, of course, to make you all part of the conversation. Licking Memorial Health Systems. Rob, the website, best place to go to start?
www.elmhealth.org, absolutely.
There it is, phone numbers, all that good stuff you can find right there on the screen as well. So thank you for being our guest today, and as always, for giving us so much information.
Thank you both for having me.
It's our pleasure. All right, we got more Daytime Straight ahead, guys, so keep it here.